Hello, today we will study about next Bachelor of Medicine, mustard. Mustard represents a state of sudden, unaccountable sadness. The individual cannot identify any external trigger. It feels as though a dark emotional cloud descends without warning. Importantly, this sadness is not linked to any specific event, loss, or disappointment. It's endogenous in origin. Mustard belongs to Dr. Edward Bach's group of remedies characterized by reduced engagement with present. However, unlike clematis or honeysuckle, the withdrawal here is not due to daydreaming or living in the past. It's due to a sudden emotional heaviness that makes present participation feel difficult. The person wants to engage, but emotional cloud suppresses the vitality. The key to understanding mustard is that the sadness originates internally. There is no identifiable external cause. The patient often says, "Everything is fine, but I feel low." This differentiates mustard from grief-based or event-based, event-triggered remedies. The emotional state comes suddenly like a cloud covering sunlight. It may last hours or days. Just as mysteriously as it appears, it disappears. This cyclical pattern is diagnostic. What is the key feature for this medicine? The sadness without identifiable trigger. Always ask patient what started this sadness. If the patient cannot identify a cause and there is no recent disappointment, conflict, or loss, mustard becomes strongly indicated. Now, how is the emotional tone of the mustard patient? It's deep heaviness, quiet inward sadness. This is not dramatic crying, it's quite heavy, internal. There may be reduced smiling, reduced enthusiasm, soft speech, slowed response. Nature of mood is cyclical, periodic reoccurrence. Mustard states often repeat. Patients may describe, "Every few weeks I suddenly feel low for no reason." This periodic pattern reinforces internal origin rather than situational reaction. Duration of the complaints are for hours or days, and it clears suddenly. Like the duration is temporary. This is not structural depression. The sudden clearing is important. Like sunlight breaking through clouds. I don't know why I feel sad. This sentence is classic. Unlike depression, where there is narrative, mustard has no explanation. The patient is confused by their own mood. How is the behavior of the patient who requires this medicine? They are withdrawn with low enthusiasm. Social participation reduces temporarily. They may avoid conversation, cancel plans, or isolate. But this is not apathy, it is emotional heaviness. Now, how do we differentiate this from depression? It's a temporary state and it's not a structural disorder. Mustard is not clinical major depressive disorder. In major depression, sleep is disturbed persistently, appetite is affected, self worth is reduced, duration weeks to months. Mustard is transient and episodic. If persistent, referral is required. What is the internal experience of the patient? Patient describes it metaphorically. It's like a cloud, like a shadow, like light switched off. These metaphors are characteristic for sudden emotional darkness. Now, what is the cognitive state? Cognition remains intact. They can think logically, work may continue. The darkness is emotional, not intellectual. This differentiates from white chestnut, where repetitive thinking dominates. Physical sensation. What are the physical sensation patient may experience requiring mustard? They may feel chest heaviness and low vitality. Some patients report sluggishness, reduced physical energy, and mild chest heaviness. However, these are secondary to the emotional state. Now, what is the diagnostic question which confirms the mustard state of the patient? Is there sadness without cause? This is your clinical checkpoint. If yes, explore mustard. If sadness follows the loss, consider grief remedies. If sadness follows disappointment, Gentian. If it follows rumination, white chestnut should be considered. Now we will differentiate mustard with other Bach flower medicines. We will start with white chestnut. White chestnut is about mental repetition. Mustard is about emotional darkness. In white chestnut, thoughts repeat uncontrollably. Patient complains of mental noise. In mustard, thinking is clear, mood is heavy. White chestnut, cognitive disturbance. Mustard, affective disturbance. This is a crucial differentiation. Honeysuckle sadness is linked to the past. The patient lives in memories. In mustard, there is no past event causing sadness, no regret, no longing. Honeysuckle sadness has narrative. Mustard sadness has no storyline. Gentian follows discouragement after failure or setback. If the patient says, I failed so I feel low, think of Gentian. If patient says, nothing happened, I just feel low, think of mustard. Gentian is reactive, mustard is spontaneous. Wild rose shows resignation and apathy. Wild rose accepts condition passively. There is no motivation present in wild rose. But mustard still cares, still desires engagement, but temporarily emotionally dark. Wild rose is emotional numbness. Mustard is emotional heaviness. Dr. Edward Bach described mustard as a remedy for deep gloom that descends without reason. It is an affective disturbance without identifiable story. The metaphor of a cloud is repeatedly used in clinical descriptions. Now we will differentiate mustard with other homeopathic medicines. We will start with first medicine, Natrum Mur. In Natrum Mur, there is a grief from past hurt. In Materia Medica Pura and later classical texts, Natrum muriaticum reflects unresolved grief. Key difference between these both medicines is Natrum Mur has clear past hurt, mustard has none. Natrum Muriaticum sadness is triggered by memory. Mustard sadness is unexplained. In Aurum Metallicum, there is despair with self blame. Aurum shows deep despair, often associated with guilt, self criticism, failure themes, suicidal thoughts in severe cases. Mustard does not carry self blame. Aurum is existential despair, whereas mustard is temporary gloom. In Ignatia, there is acute grief reaction. Ignatia follows acute emotional shock, and symptoms are seen as sighing, lump in throat, contradictory emotions. Ignatia has identifiable emotional cause. Mustard does not have identifiable emotional cause. Now, sepia. In sepia, there is indifference and detachment. Sepia shows emotional indifference. Mustard shows sadness, not indifference. Sepia is irritable, detached, wants to be alone long term. Mustard is temporarily withdrawn, but baseline personality returns. Homeopathic constitutional depression remedies involve deep personality patterns. Mustard represents a transient state, not a deep rooted constitutional pathology. This is important to avoid the overprescribing heavy constitutional remedies. So, what are the common patterns we can find in mustard patients? Typically, mustard individuals have a normal or even cheerful baseline temperament. They function well, they engage socially, they perform professionally. Then, suddenly, without warning, mood drops. This contrast between bright baseline and sudden darkness is diagnostic. How is the personality of the mustard patient? Mustard personalities are often emotionally sensitive. They may feel deeply, respond strongly to atmosphere, be affected by subtle emotional shifts. However, the sadness is not necessarily triggered by sensitivity. It emerges internally. Now, how will be the child expression requiring mustard? In children, mustard may present as suddenly becoming quiet, reduced playfulness, not wanting to participate, sitting alone without clear reason. Parents may say he was fine yesterday, today he is silent. How would be the adult expressions? Adult may avoid social calls, reduce communication, cancel meetings, prefer solitude temporarily. But importantly, this does not become chronic isolation. What should be our therapeutic aim when we give mustard to patient? The aim of the mustard is not suppression. It helps restore the natural emotional rhythm. It allows the sunlight to return gently and steadily. What early response we can expect when we prescribe mustard to the patient? That cloud things gradually. After administration, mood may feel lighter, heaviness reduces, emotional clarity returns, energy improves. The change is subtle, not dramatic. Later, what response we can expect is emotional rhythm stabilization. With continued use of mustard, frequency of episodes reduces, duration shortens, emotional baseline stabilizes. Patients report fewer unexplained low phases. Dosage is standard batch doses. 4 drops in water 4 times daily. In acute phases may be taken more frequently. Always assess response over time. If sadness is accompanied by repetitive thinking, Combine mustard with white chestnut. If sadness leads to significant fatigue, mustard can be combined with olive. Combination should be based on symptom overlay, not routine mixing. As we should understand when to prescribe mustard, it is also very much important that when we should not prescribe mustard when the patient is not mustard. If sadness has clear cause, do not prescribe mustard. If there is a clear grief, recent loss, identifiable disappointment, chronic major depressive disorder, mustard requires absence of narrative. Persistent major depression needs evaluation. If sadness lasts week continuously, affects appetite, sleep, work, includes suicidal ideation, immediate psychiatric evaluation is necessary. Batch remedies are supportive, not replacements, emergency for emergency care. What is the meaning of healing in case of mustard? It's like a sun returns after cloud. Symbolically, mustard teaches that emotional darkness is temporary, light returns. Patients regain emotional equilibrium naturally. What is the key message? Key message for the mustard is mood arises internally. Core clinical takeaway is not all sadness has a story. Sometimes mood originates from internal rhythm shift. Understanding this prevents overanalysis. If this explanation helped clarify emotional states, support the educational series, share to increase awareness of subtle emotional remedies. In remedy selection must always consider complete case analysis. Thank you.